This is Dr. Heberly, and these are his patients. They have gathered here to help him give donations to fund his legal defense against the DEA. After the DEA successfully prosecuted another doctor, the Attorney General assigned that doctor's chronic pain patients to Dr. Heberly, who was then prosecuted himself shortly thereafter. Rather than narrating the facts of the case, we decided to let the patients tell their own story.
I've had fusion of my neck, 7 back surgeries, and I just had my last surgery July 13th. My name's Pat Rotunda, and I'm disabled. The first 5 surgeries, actually, I wouldn't touch pain medication. And when they fused my back, that's when I started taking pain medication because the pain was horrendous. And then this last surgery, my doctor, I said, if this surgery works and I get rid of at least 50% of the pain, I want to be taken off the medication and weaned down. He said, don't worry about that now, my family physician. Don't worry about that now. When that time comes, we'll cross it. And then the next thing I know, I get out of the hospital to call for my pain medication that was due, and he said, go to detox.
Why?
I don't know.
He never told you?
No.
5 years ago, I fell off of a roof, took a real bad fall. I destroyed my left leg, severely shattered. As a matter of fact, I have what's called a non-union. It's a broken leg that'll never heal. My name's Tim Burton, and I'm a carpenter. They put me on disability. I don't want to be on disability. As a matter of fact, because of medication, I've been able to go back to work and function as a working carpenter. Now that Paul's going through all this stuff, they've reduced my medication in half and I can't work anymore. I own a $120,000 house. I've got car payments, I've got, mortgage, the whole 9 yards, and they're making it impossible for me to earn a living.
There seems to be a huge misunderstanding of what it really takes to make a chronic pain patient comfortable. My name is Lisa Mello, and I work for Dr. Heberly as front-end office staff and in the back with patient care, a little bit of everything. I am a chronic pain patient. He became my doctor 6 months prior to me starting to work for him, and I had been out of work for 4 years. I had 2 neck surgeries and a whole lot of other problems as well. And I was going to the Cleveland Clinic for a year and a half, and they were not controlling my pain at all on the low doses of medication. And he got things under control. And I never felt sedated in any way. I was just able to function normally again.
Say your name.
Richard DeLuca.
Okay. And how do you know Dr. Heberly?
He's been treating me for chronic pain for a while.
What's your chronic pain caused by?
Well, evidently a tumor.
What kind of tumor?
2 brain tumors and a lung tumor.
And how has Dr. Heberly helped you?
Helped me work. Helped me do my job.
And what did you think when you heard about what's happening to him now with the DEA?
It really got me mad. It really did.
And what's your pain situation now?
Well, I don't have any pain right now, but who knows what it's going to be like in another week.
What happens in a week?
I go off it.
Do you think the DEA is maliciously prosecuting doctors?
Oh, absolutely.
And if so, why?
Why? Hi, I'm Paul Heberly. I'm a physician. Basically, I've just been harassed and railroaded and now charged with illegal prescription writing. A doctor was arrested, and his pain patients were essentially abandoned throughout the community. So I took on many of these displaced patients.
He was prosecuted by the DEA or whatever, and
Right.
then they gave him to you.
Right.
and then they prosecuted you for treating them.
Right.
How could that possibly happen?
Well, I don't know.
They say it's because some of the local pharmacists had complained about the high amounts and quantities of medications he was prescribing. But when you're one doctor in an area this size that is treating the vast majority of chronic pain patients, you are going to have a high volume of prescriptions going out. I mean, it only makes sense.
People who are going to abuse it and take the medication and sell it on the street should be locked up in jail. I'll be the first to admit it. But the person such as myself that just wants the medication so I can go to work, so I can produce a lively income for myself, so I don't have to be a welfare recipient, should be able to get this medication and should be able to function as a United States citizen. You know, disability. The Bureau of Disability wants me off of disability. They don't want people on disability. That's throwing money away. Let's face it, it's our tax dollars. Well, why are you going to refuse me medication so that I can work 40 hours a week then?
I'm here just to let people know that there's people like me out there that are in horrendous pain that can't get help, that we're looked at more like as drug addicts than people in pain.
There is a distinct difference between the legitimate chronic pain population and between the addiction population, and there are medical ways to address them both. The law enforcement methods are just mixing up populations and causing an unjust environment for anybody with a serious pain issue to even hope to get adequate treatment. These are not honest agents. If the public knew how they really conducted themselves, they would not tolerate it.
We now skip forward a few weeks after the party. Dr. Heberle is having a preliminary hearing to see whether or not his case will go to trial. Patients are gathered outside the courtroom, hoping to get a chat with the news media, or at least be there to support their former doctor.
I'm here to support Dr. Heberle for something that he is being blamed for that is not his fault. Patients misabused medication that he gave them, he should not be prosecuted for. That was their choice to take their medication out properly. I think it's a bunch of bullshit. I just think he's being unfairly prosecuted. I feel for Dr. Heberle. I mean, this is ruining his life. Literally ruining his life. And it's not his fault. And he's the one paying the ultimate price. He has no practice. He doesn't even he's not even an emergency room doctor anymore. He's going to lose his house, his cars. What else can he do? He's paying dearly for defense, just to defend himself against something he should never even been charged with.
Are the patients paying dearly too?
Yes. Oh, yes.
Shortly before the courtroom opened to allow people inside, I was confronted by an agent from the Attorney General's office.
What's that?
We're
Okay, I do not want those to
Who are you?
I'm an agent with the Attorney General's office. So if you have one, take it, please mention it. Because if I see it anywhere, I will come see it. Okay? Thank you. I speak for myself and all the other agents that are sitting out there. As drug agents, obviously, we don't like our faces on the
Sure,
news.
I understand. I understand. Perfectly understand.
When I asked the prosecutor in the case for an interview outside the courthouse, he declined, followed immediately by shilling to the news media. But the people who have been most affected by this case are not the drug agents or the attorneys, but Dr. Heberle himself and his chronic pain patients.
I am on such a different regimen of medicine Up until today, I've made my stronger medicine stretch out and last so I could get through this. But starting tomorrow, I know that I'm not gonna have the medicine that I need to be covered. And they don't care. Why would they? It doesn't affect them in any way. But, you know, and my doctor knows that I need more medicine. And he agrees with Dr. Heberle's regimen that I was on. And he would put me on that. But you know what he said? I don't want to be the next one. Who wants to work hard their whole life to end up in jail?
All I can say is thank God for doctors like Dr. Heberle. He made things a little bit better.
In May of 2006, Dr. Heberle was acquitted on all charges by a jury of his peers. Shortly afterwards, his wife wrote to me and said, "The fact that Paul won his case should prove that the agents and prosecutors have the ability to destroy your life at will. They don't really care if a crime has been committed. They aren't really after the real drug dealers. The fact that they have involved themselves in legitimate medical care and try to criminalize it speaks volumes." We were fortunate that we had a good working team. Financially, the team cost somewhere around $250,000 in borrowed money. Emotionally, I cannot put a price on any of it. I cannot put a price on how many patients suffered and died without care. I cannot put a price on how many people lost their homes or jobs without care. I would really want to know how much of the taxpayers' money was spent hurting so many people.